Lyme disease is something that has had a lot of controversy. There's been a lot of politicalization of Lyme disease. There's been a lot of sensationalization of Lyme disease. What we know for certain is that people have it, right? It exists. This is not something that's magic fairy dust. When a person is first sort of becoming aware of Lyme disease, or once a person's diagnosed, or the experience of that individual is consistently one of profound fatigue. And I don't mean, had a late night and a tired morning. I mean, people are often finding themselves unable to function. And so that's not normal. It's never normal. So profound fatigue being a main sort of unifying symptom. Beyond profound fatigue, Lyme varies tremendously. So there are lots of individuals who experience Lyme arthritis. And what makes this type of arthritis different from other arthritises is that it moves. It's what we call roving joint pain. So it's different joints at different times for different lengths of time with seemingly no stimulus or aggravating cause. That is very unique to an infection. Some of the other symptoms that happen are really unexplained neurological symptoms. So it's incredibly important for a person who has numbness or who has tingling or who has neuropathies to go and get a thorough workup, because Lyme disease is not just a diagnosis made by testing. We know that testing methods for Lyme disease are notoriously inaccurate, but it's very much a disease of exclusion. So has everything else been ruled out and ruled out appropriately? And then are people experiencing still these profound symptoms? So that's the neurological Lyme or neuro-Lyme. There's also often effects on the heart, so a lot of palpitations, a lot of air hunger where you just feel like you can't get enough breath. These are also things that are common with a lot of the co-infections with Lyme disease. So I suppose it's important to understand that Lyme is not typically one single bacteria. It's what we call Lyme and associated diseases, or a tick-borne illness. And when those infections are transmitted, typically by a tick, they are transmitted all together. So that's anything from Ehrlichia to Rickettsia and Babesia and Bartonella. There's lots and lots of co-infections that occur with Lyme, which is Borrelia. And occasionally you get those co-infections without the Lyme, just to throw a wrench in and make things complicated. So again, it's very important to really focus on the symptoms that the patient is experiencing, rule out all other causes of disease, of those conditions, or of those symptoms, and then start to evaluate, is there a possibility of exposure? When was the onset? How does all of this picture fit together so that we can come to a diagnosis very holistically? And that's really how Lyme should be approached appropriately. When it comes to Lyme treatment, there are many different treatment courses. There's many different recommendations. I have, studied extensively Dr. Joe Burrascano's method. Of course, he's an MD from New York, and of course, because being conventionally trained, he's very heavy on various antibiotic regimens. And then there's more herbal regimens like the Stephan Buhner protocols and the Cowden protocols. And I think that if there was one way, if there was only one method, we would know that by now, which really highlights how every single person with Lyme is going to have a slightly different disease process, is going to have a slightly different symptomatology, and is going to require a different way of managing. There is no one right way, which makes my job complicated and an adventure, but one that I'm happy to take on, because the difference is in people. I mean, I have had those patients who came in a wheelchair and walked out. I've had those patients whose lives were completely non-functional. They were mothers who couldn't take their kids to school, and fathers who were bedbound. And through appropriate treatment, are living normal lives. And that is an astoundingly beautiful thing to get to be a part of. It's a process, for sure, and it's one that requires lots of tweaks and lots of adjustments, and is not typically fast, unfortunately. However, it's a very, very lovely thing when somebody who's been misunderstood for a long time can get relief